I got it. I sent to RGCC. Hopefully the connection is good. It looks good for now.
Kamu buka tak alih ni dah apa nak pakai tu tak? Ya ya. Okay. Alright.
So I go live now.
Okay. 3, 2, 1, action.
Good evening and Salam Ramadan to all my Muslim viewers. Welcome back to Talking Life with Mei Sze, a podcast centered on health and wellness. Well, if you remember or recall the previous few episodes, we were talking about the various types of cancers, such as breast cancer, we had pancreatic cancer, and talking about all of these types of cancers, we talked about the treatment of it, the symptoms, but we were talking about how to manage it as well. But when we talk about all of these types of cancers, we want to find out more about the individual ways to manage cancer. So it's found that 1 in 4 people around us or rather worldwide will actually be afflicted with cancer one day. It could be someone around us, it could be yourself, but there is so much lack of information, or rather people don't want to know about cancer in this day and age, or in any time, especially in Asia. Not so sure about worldwide, but I know in Asia it's still a taboo topic. So when we talk about cancer, and let's say if someone around us have it, then they scramble for information when their relative or someone close to them have it. By that time, it could be too late. So it's best to equip ourselves with the knowledge on cancer management, cancer treatment, or just about the various body parts that could actually have cancer. So although there are a lot of advances in cancer treatment nowadays, but a huge gap lies in personalized cancer management. And I guess this is where treatment can be tailored to an individual. I don't believe that, I believe in research personally and all the evidence-based research out there for all the cancer treatments. But you can see that some cancer treatments work better for some people and not for others. Why is that so? Because maybe it's not a one-size-fits-all kind of thing. So today we're going to dive deep into that. And also in my previous few episodes, many of you always asked me, what should I eat? Can I eat this? Can I take herbs? Can I take traditional medicine? Cancer, or when I'm a cancer survivor, these questions pop up every single time I have a live session. So we are here today to actually answer them and to find out more about how these traditional medicine can supplement and support your traditional cancer treatment. And we have here today Dr. Sarah Kong.
Thank you.
From RGCC Southeast Asia, who will share with us more about what personalized medicine is. So let's get to the groundwork, Dr. Sarah.
Thank you for having me here,
Yeah,
Dr. Chu.
thanks for coming on the show. We want to know, what is personalized medicine? We hear about it,
Okay.
but we don't know what it is.
So I think personalized medicine falls down to 4 main things, Dr. Chu. Right person, right diagnosis, right treatment, right? Basically what you're trying to treat them with, and the right timing. Okay, so I'll give you an example, a simple example that we all face. Say we have a headache, like 2 people who's having a headache. So you and I may be having a headache, but what will work for you? Say a Panadol, 2 Panadols will work for you. But for me, I might need an ibuprofen because I might be having a migraine and you might be having a sinus headache. So different people, different diagnosis, different treatment. And say if I have a migraine, I need to take it early. I can't take it too late, right?
Yeah.
Some of it you take before or after food. Like, which part of the disease do you take it? So personalized medicine is making sure that, number one, you have the right diagnosis. That's the most important thing, right? So you have the right diagnosis and it's for you. That means if someone has cancer, it's for their particular cancer, for them, the right medication that will work for it, and you're giving it at the right time in the course of the disease. So that's essentially what personalized medicine is. Sure.
So basically, like what I mentioned, personalized medicine is to kind of like, it's not a one-size-fits-all mechanism.
Yes.
And it's to be suited to an individual. So the
Yes.
treatment is catered to that particular individual
For
based on
their
the
particular
test.
diagnosis, right?
Right. Okay. So I get that. And like I mentioned earlier, cancer treatment efficacy is different for patients. Some people respond better than others.
Yes.
So what is the reason for that? Maybe you can share a little bit more about that.
Okay. So cancer treatment, when someone is diagnosed with cancer, right, Dr. Chu, they will come up with, okay, this is the diagnosis, tissue biopsy is done, and we say, okay, then we stage you. So if, for example, most commonly breast cancer, right, breast cancer stage 1, stage 2, the oncologist will say, okay, once you've done surgery, depending on your findings, this is the chemo that's recommended for you based on studies, lots of studies. So this is our clinical practice guidelines. So that usually works most of the time. But the problem comes in not in that early stages. It's when the cancer comes back after 3 months, after 6 months. That is when people face most problems, right? It's not at the first onset. So in that situation, the cancer would have mutated, right? Cancer presented already as something aggressive, but it would have mutated. So therefore, the character is already different. Okay? So you need something that will work on it. So in our GCC, we do a test where we isolate the cancer cells, right? Okay, we isolate the cancer cells through, so biopsy is done, diagnosis is done, imaging is done, so we already know the full diagnosis, right? So say it has recurred, then what now, right? What can you do now? So you can do a blood test where you isolate what we call circulating tumor cells. So they are live cancer cells, so imagine the whole live cancer cells. We can isolate that and we can apply tests on them using the different cancer drugs or natural extracts to see what will kill it. Right? So it's almost like having a urine sample. So you have a UTI, you do a urine sample and you test 10 different antibiotics, which works. So this is the same concept, but on the cancer itself. So you can do the chemo drugs, the immunotherapy drugs. So some oncologists use that. But more importantly, you can do the natural extracts. So sensitivity is number 1. Secondly, there's also some parts of the cancer that's expressed as a gene that's called the resistance factors. So we test for 4 types. The first type is where if there's a chemo drug introduced to the cancer cell, it's called the MDR, it will pump it out. So it doesn't matter sensitive or not, it will just pump it out. It's very clever in that sense. Then there's another one where if it forms a complex with glutathione, pumps out as well. Then there's a third type where if it goes in, the cell will just form a nice vacuole around it, isolate it, and that's it, it can't work anymore. Right? And there's another part where they use glutathione to neutralize the toxic effects of the chemo. So if you can identify these resistance factors, there are ways to bring it down to make sure that the sensitivity of the treatment can actually work to its full sensitivity, to its full kill rate. So this would be 2 aspects that I would think of, Dr. Chu.
So it's basically adding things like supplements like glutathione into our...
If it works.
If it works for that particular person.
And that cancer that they have.
I see. Okay. So to the audience who is watching it now, you can kind of see the direction that where we are going in terms of what we are talking about, personalized medicine for cancer management. So if you have questions about what we are currently discussing, please put them in so we can actually answer them towards the end and pick your questions. We would like to answer as many questions as possible because there's so many times all of you ask me about herbs, traditional medicine, supplements like glutathione or
Vitamin C?
Yeah, vitamin C, which are all actually part of natural extracts in the
Yes.
test, I believe. So, okay, it's very interesting to know that natural supplements also act as kind of like an agent to combat the cancer.
Okay, so the tricky part of the truth is like this. People out there have this misconception where if I do chemo, I cannot do alternative. If I do
Yes.
alternative, I cannot do chemo, right? So that's where it's wrong. There is a middle ground that we can come to. So it's more on the timing of it. And of course, when you read online, everything works. Everything seems amazing. Apricot seeds, or you go to any pharmacies, you will see that everything seems interesting, right? And all of it will say, we come with case studies that, oh, it worked on my cancer. So we try, so our role is to help our patients focus on the right thing. You do your chemo, we can support you in between using these natural extracts because they have studies, and if the sensitivity works, then you know that this can work on that patient. But timing it is important. So if you're doing chemo, don't do anything else. Skip it for a few days. Then you use it. I had one patient who was on chemo for breast cancer. She had 6 cycles. First 2 cycles, we supplemented her with high dose vitamin C. So she had very minimal side effects. Then the third one, she skipped her vitamin C. She had a lot of side effects.
Okay.
So she came back and said, no, I'm sorry, but I still have to do my high dose vitamin C. And then she felt better. And it didn't reduce the efficacy of it if you time it right. So we need to do research. So doctors need to help the patients time it right so that it doesn't cause problems against whatever mainstream treatment that they are on.
That's interesting. Okay, thanks for sharing that. I guess the next question that I had, I mean, since we are talking a lot about, personalized medicine and drug sensitivity is about that. How can we know the drug sensitivity and effectiveness of cancer drugs on specific cancer cells? And basically, how do RGCC tests assist patients in selecting the most effective ones?
Okay. So usually, like I mentioned to you, Dr. Chi, it's all usually from a blood test, right?
Yeah.
Because not all biopsies, not all cancers are easily accessible by biopsy.
Yes.
So we do a blood test. We will draw the blood test about 20 mils, 25 mils, and this will be in a vial and we send it over to Greece. So the lab there is accredited to do these tests. And what they will do is they will isolate the cancer cells, grow it into a tumoroid, right? And then do actual testing, sensitivity testing on it, depending on what you're ordering. So if you're ordering, I want to test the chemo sensitivity, so then you do certain tests, and then they will test all the different chemo sensitivity and give you, as a report, how many percent will it be sensitive. So that means what's the kill rate, right? 80%, 90%. And then you'll be surprised some of it is not at all sensitive. So that is quite surprising. So we do the same thing for natural extracts as well. So we have a range of 53 natural extracts that we already test. And then some people in Malaysia have this concept where they want to try different herbs. So they will give it to us, we will send it over. They will also test it in the lab. Like some people like soursop, some people like a certain local
Yes.
herbs, right? So we will take some of these herbs, we send it over to the lab. The lab will do their research on what's the active ingredient, what is the mechanism that is going to treat the cancer, and they test it for us. And they tell us that, okay, this works, you can use this. Because you'd be surprised, Dr. Chu. So most people believe curcumin is great, right?
Yeah.
But recently we had 2 patients who came back and the curcumin sensitivity is 0.
So curcumin and turmeric are somewhat
Yes,
similar.
yes.
So it could be turmeric extract as
Yes,
well.
exactly.
So yeah, basically saying this test, RGCC test, can provide data such as, this type of information
Yes.
to the patient, whether supplements such as curcumin extract or
Works.
turmeric extract
or
works,
vitamin C.
or vitamin C to help combat the cancer.
Exactly, Dr. Chu.
And I think for those of you who are watching this, it's important to note that this is for patients who actually already have cancer,
Yes,
right?
they already have cancer. So it's not for random people,
Okay.
because we're testing it against their cancer cells,
Okay.
right? It's not it's not pharmacogenomics where it's against your genes. No, this is actually applying it onto the cancer cells. So RGCC, what they will do, they will divide natural extracts into 3 main action. The first one is actually killing the cells. We call it cytotoxic. right?
Yeah.
So vitamin C is one of these, right? So vitamin C, like I give you an example, what vitamin C does to you. Cancer cells love glucose, right? We all know
Yes.
that. So vitamin C will act, high dose vitamin C will act like glucose. So the cancer cell will absorb 19 times more glucose and vitamin C than normal cells. So the high dose vitamin C will enter the cells, right? Because it's more attracted to, cancer cells are more attracted to it. Then what happens is normal cells can neutralize vitamin C after you've done using it, but cancer cells cannot. So it stays in the cancer cell, it produces hydrogen peroxide, and it kills the cancer cell. So that is one mechanism of action, cytotoxicity, right? Then you have some things like turkey tail, alpha lipoic acid,
Okay.
NK cell boosters, right?
Yeah.
Immune boosters. So that will be tested under how it boosts our immune system against cancer, right? And then you have the third class where, okay, so we have certain processes, cell processes, and cancers use these processes more than normal cells. I'll give an example that's like VEGF, right? So it's one type of gene,
Yeah.
all right? It's a gene that grows blood vessels, okay? So it helps cancer feed itself.
Okay.
More blood vessels, more nutrition to the cancer cells. And that's how cancer grows, right? Or how it spreads. So green tea extract can block this pathway.
Wow. Okay, that's
So
very interesting.
that will be under a different class. So usually what we will do is we will help the patient identify what you want to use, see which action it falls under, and then look for that sensitivity.
Okay, so I think maybe I want to clarify to the audience who are viewing today that I think many of us have we are told, not to do alternative treatment
Yes.
while we are on cancer treatment. But I believe with RGCC testing or these types of tests outside, it's very important to know that there are certain types of supplements or herbs that we can take to supplement and support our cancer treatment. But it's not like I said, a one-size-fits-all kind of thing. So you need the proper testing to get the right type of supplements or herbs, because you can be taking A to Z, but not all of it will be
And some of it can be
effective for
toxic
you,
as
and
well.
some of it may not be good for you.
Yeah.
So there's actually a lot of word that melatonin
Yes.
is effective
amazing.
for cancer patients. So I'm sure you test for.
We do. We test
Yeah.
for melatonin, which
Yeah.
is one of the, actually they're written most of the time quite sensitive for the
Yes.
patients. And melatonin usually works in amazing ways, right? They're
Yes.
antioxidant, they get you to sleep, and that's one of the most important things for cancer. So yes, melatonin is what we test for. We test for vitamin D, quercetin, the soy extract, genistein,
Yes.
resveratrol.
I mean, so
CoQ10.
many.
Yes.
I mean, when you are telling me, I can tell that you are basically testing for so many
Things that are
natural-
very common.
Yeah, and on top of that, they also test for the types of treatment that is efficacious for the patient as well. So it could be immunotherapy, chemotherapy, targeted treatment.
I spoke to an oncologist once, Dr. Shu, and I asked him, because in Philippines, they use this test in mainstream, right? And in Indonesia, they use it in mainstream. So I sat down with him and I said, can you tell me, like, how do you use this? Then somebody asked him one day, do you use it for all cancers? Like, is it from the very start? He says, no. In the beginning, cancers are cancer, but they're not so aggressive because they haven't recurred, they're not metastatic, they're not advanced. So he said, then I follow the guidelines. But if it comes back resistant, it comes back advanced, and it's no longer acting like the first line, then he says his good conscience tells him to do this to back his decision making, so that he can choose the next line back on sensitivity. And he says his patients do very well, actually, Dr. Shaw.
That's very interesting. Okay. Talking about natural substances to treat cancer, how would you say RGCC provides precise information on effectiveness of natural substances to kill cancer cells?
The way it is, Dr. Shu, or in terms of how to take it? Okay, so our team consists of medical clinicians,
Okay.
right? Dr. Yonis himself, the founder, is an oncologist. So he's very particular because he is mainstream. And then we are integrative doctors we're a bunch of us. So we will do the tests. Doctors will do the test for their patients, and they come up with a range of sensitivity for all the different natural extracts. And then we will talk to them. We will sit down, we will guide the doctor can guide the patient based on what we know about the natural extracts, because you need to know the
Okay.
half-life, you need to know the excretion, what is it contraindicated for, is it going to be toxic for the liver, if they have mets to the liver, what are you going to do? So all this is not, doing the test is one thing, Applying it is a different thing. Actually.
Yeah.
So that is where we sit down, we learn from each other based on whatever current
I see.
information that we have.
So I'm a personal believer of functional medicine. I believe that we should take supplements to support. I mean, it has helped me a lot because I started it a couple of years back, and I believe that certain supplements work for me because I do it based on my blood test, which is
Yes,
similar
yes.
to what you guys do.
Yes.
And I don't simply take every supplement out there. I'll just take what is meant for me to supplement what
In
I'm
this
lacking.
particular time, right?
Yes.
Because there's different. So if you're treating cancer, you try and remove most of the supplements. You just give the supportive. Then once you're done with the treatment, then you want to also try and kill some remnants cancer cells. So the timing makes a big difference, actually. And as well as some people who don't have cancer, but risk factors, family members, they want to prevent. So they could do. But I mean, of course, our test won't apply for them. But it makes sense to personalize it.
So the timing is very important.
Very important, actually.
And I mean, for me, like I said, I'm a personal believer of functional medicine already. So having this type of tests available for patients who are undergoing treatment is actually very good.
I would like, just now I mentioned apricot seeds, right? You know
Yes,
how
I mean,
toxic they
everyone
are,
talks
right?
about apricot seeds.
Yeah, and they said they'll eat the seed. But the thing is, so the B17 component of apricot seed has been shown to work in certain cancers, but we test it. So if it works, then you can use it. But it's toxic, right? So at least if it works, then it's fine. It's a risk worth taking. But if it doesn't work, then it's okay. Move on to something else.
Yeah, I think that sounds reasonable. I think the next question I have is, how does RGCC help patients increase their success rate in curative treatment in terms of cancer and to save money in a way?
Okay. Money is always a big thing, actually, and then especially in this type of test, especially in cancer itself,
Yeah,
right?
cancer is so expensive.
Cancer is expensive. Surgery is expensive.
Everything is expensive.
The whole thing, right? So we believe that no matter what, they're still going to be spending a lot of money on treatment, right? But if you can have something that tells you what will work, then you can spend money on the right thing, right? Rather than, oh, I'm going to do B17, but B17 is not working. So you do on that. So I believe that when you have like a guidebook, like a map as to understand your cancer, then you will know what will work on it. So you can make better choices, economical choices to shove your resources towards the right treatment plan, so that for a better success rate.
So you would say that, like for a lot of patients out there, maybe go for RGCC, get tested if they want supportive treatment in terms of,
to support whatever they're going through.
What they're going through. Okay. I guess in Malaysia, I would definitely ask, but before that, I'm gonna ask my last two questions. So if you have questions, you can put them in now about what we talked about personalized medicine for cancer management, and I think more about these natural substances, elements that can support cancer treatment for those of your family or friends around you that are going through it. And I think the other thing is, like, if you want to find out more about drug sensitivity, what types of drugs actually may work for the cancer? So these are the questions that if you have, you can put them in now, because we want to pick up interesting questions from you guys, and we have Dr. Sarah here and we want to answer them. So one of my last questions is, in Malaysia, how can patients access RGCC tests? Malaysia and Singapore, basically.
Okay, so we need, it needs to be done by a doctor first, actually. So their doctor needs to be the one that does the test. Primary care doctors can do that. So we have like a list of doctors all around that's trained to do and choose the right test and do the test. Then they just have to let the doctors know that they want to do the test. Then the doctors will arrange a time to extract the blood. DHL will pick up the samples, send it over to Greece, and usually you get your test results in about 2 weeks.
I see. So it must be through a doctor.
Yes, we do need a clinician to order it, interpret, so that they can interpret it for you, with you, and if anything, they can come back to us and we can answer their questions.
But it must also be that the clinician knows about RGCC.
Exactly. So they need to reach out to us and then we can direct you to clinicians that's trained.
Okay, I see. Okay.
It's not that it's spectacular, but they need to understand the test as well. So that part is the part where...
But if they don't watch this live, no one will know about RGCC. So where do they find you?
So they
Is
are
it online?
So generally, we run a very active online platform. So they can reach out to us on our RGCC Southeast Asia website.
Okay.
So
website.
So reach out to us. get to us by either WhatsApp or email, then we will answer your questions. Usually I'm the one who's answering the questions. So I will reach out and I will say, okay, where are you based? Can you tell me about yourself? Then we roughly tell you about the test. And then we will say, who are you comfortable with? Who do you want to see? Then we will direct you to somebody who's trained.
So we hope that if you need this, you're watching this live, number one. And the other thing is to find them on the RGCC Southeast Asia website.
Yes.
And I believe RGCC Southeast Asia is tuning into the live right now. So if you have questions and I don't pick up your questions for Dr. Sarah, they will try to answer your questions as well. So you can approach them on their Facebook as well.
Yeah.
So that is my last question. And it's time for me to actually check out questions from you guys. Let me pull out your questions. So we want you to start putting in your questions now. We want to hear from you. Okay. So the first question I think is, I like this question from Rainy. How often should the RGCC test be conducted regularly? It's not.
No,
it's just
it's not a
one.
regular thing. It's usually we don't do it very often at all. Actually, we do it in the when it's recurred and we're not sure, so we do it one time. It stays relevant for quite a while. We usually do it. Sometimes the earliest will be after a year when you find that I think the cancer may have changed. I think it's a little bit more aggressive. It's acting a bit differently. Then you could. So there's some protocols that say annual, but definitely not less than that. And so far from our experience, it lasts, the relevance stays there for much longer than that.
I see. Okay, so I would like RGCC, if you're tuning in now, to come on the live and comment so people know where to look for you on your page as well. So it might not be easy to search for you on your page.
Yes.
So if you can come in and just say hi. Okay, the next question I believe would be pretty interesting is it practical to test for so many extracts? For example, how do we shortlist this important extracts or supplements to test? That's also another good question.
Okay, so our test comes ready with 53 natural extracts. So they don't have to choose. It doesn't mean that you choose 10 or you choose 50, it's going to be different. No, we already test it for 53 extracts. Because if you go out there, you Google natural extracts for cancer, Dr. Chu, you've seen the multitude of different extracts that everyone is talking about. And then the moment you do that, Google will pick it up and then send you on Facebook and send you all these advertisements.
Yes.
And a lot of things out there. So we have that 53 list already. But if, for example, you have anything else that you have read about that you're interested in, you can add 5 more. And the lab will test it. Either you can send it, or if we already have it, we will test it for you.
So we can only add 5 more into the test.
That is free. That is already part of the cost. You can add more, but that comes at a slightly extra cost.
Okay. I think this question, I believe many would want to know as well, is how much does it cost for personalized testing? Is this test mainly for cancer patients?
Yes, this test is for cancer patients, Dr. Shu. It is specifically for cancer, because if we can't isolate the CTCs, we cannot do the test because we are testing it directly on the cancer cells. So definitely cancer cells. It costs maybe on average, maybe about, so the basic CTC testing will cost about maybe 6,000 ringgit. And the full range of sensitivity will cost you about 18. So you're talking about sensitivity, maybe about 13 to 18,000 for patient price. But that's why we mentioned the economy of it. So you do that test, you're saving on a lot of other things that don't work.
I think I have a personal question. It would be can patients actually use this because it's testing for circulating tumor cells?
Yes.
So the patient must have cancer. If let's say you test the patient's blood and there is no CTC in their blood, does that mean that they don't have cancer?
No, it doesn't. So there are certain there are actually a few scientific reasons, Dr. Shu, that might be very complicated to explain. But there are some cancers where the cancer is too early, or the cancer is contained, that is not in the circulation, where we can't get CTCs, right? So that's one. We also have circumstances where the immune cells, the macrophages, have engulfed the CTC, so they form a complex. So in that instance, we can't isolate CTCs. So our CTC sensitivity for detection of CTC has a sensitivity of 86%. There's 14% where the immune complexes might be formed, the cancer might have been, immediately after surgery or immediately after chemo, it's contained within the surgery, the cancer itself, they might not be in the circulation. So it can happen.
So
Yes.
would that mean that the cancer is gone, or?
Not necessarily. Not necessarily. It's
I
just
see.
that they are certain, because it could be that the immune system is trying to engulf it,
I see. Okay.
right? But in that case, then we can't isolate, then we won't do the test.
Okay. So thank you for answering that question. We're going to take one last question. If you have any more questions, put them in, because RGCC will be able to reach out to you and answer them if it's not covered in today's show. So I think this question is from Julia. Will RGCC communicate with my oncologist to make sure it is compatible with my cancer treatment? I think I like this question as well.
Okay, so we would definitely, because we have research, right? The Greece team have a lot of research papers. So we would do our best to support whatever findings that we have in the results so that the oncologists can understand the test further. Because I think the test is wonderful if you understand it. If you don't understand it, then it's difficult. So we have the research that backs it up. There's one paper that we just published this year actually, how oncologists adjusted their dose based on the sensitivity and doubled the survival time. So that was just published literally this year.
Wow.
So to me, that's one of the strongest evidence that we have. So we will do our very best to support all our findings to be able to speak to the oncologists.
Okay. So thanks a lot for answering all the questions that I put forth.
Thank you so much.
RGCC will come on, yes, and they will say hi. So you can reach out to them on my Facebook page. And once again, for all of you out there, remember to share this live with people who are afflicted with cancer, whom you know. And more importantly, we talked a lot about questions that all of you always ask, like, can I take herbs while I'm undergoing treatment? Can I take supplements? So these are pressing questions, I believe, because many of you always ask me. So if you did not catch the earlier segments, please do so. And we hope to see you next week. Next week's session is on colorectal cancer, because as you all know, it's Colorectal Cancer Awareness Month, and I'm a colorectal cancer survivor as well. So we would like to thank Dr. Sarah from
Thank you
RGCC
so much.
for joining us. Thank you so much for joining us. And thank you all for staying tuned tonight. Selamat Ramadan to all of you Muslim viewers, and we hope to see you next week on colorectal cancer. We're going to talk about the new hope out there, and it's going to be a lot of good information. So we'll see you then. Bye.